Okay, we'll go ahead and get started. It's a couple minutes after now. So I'm Garrett Fisher,
Corynn Newman.
we're the PAs here at Aesthetic Solutions. Sorry, we're having some technical difficulties. We'll just get through that.
Today, just a brief overview. We'll just kind of talk about the tattoo removal process, the lasers that we use. We'll have some photos that we'll be able to review together, and then some time at the end to answer some questions. So most people are familiar with tattoos and the process. With tattoos, an artist is taking ink. They're using a specialized needle that moves really quickly in and out the skin, sometimes even going like 200 times per second. And with that, they're just depositing that ink deep in that dermal layer of the skin. So the outer layer, the epidermis, that's those cells that are constantly shedding and replacing, whereas those deep dermal levels are going to be more stable and more constant. The body does see this ink as foreign, so it does send immune cells and macrophages to attempt to clear the ink. Small little ink particles, they are successful, but most of that ink is going to be too large for those little macrophages to gobble up. So then you do get that ink embedded within that dermis, surrounded by those cells, but it becomes a new permanent feature of the skin. Older tattoos, you'll often see they become a little bit dull, blurred. Blacks can often look a little bit more blue. The immune cells are still present, so often they will get a little bit of ink to clear, but often what we're seeing too is that ink is settling deeper in the dermis, creating that blurred look.
So the lasers we use to treat tattoos, which we'll get into a little more specifics in later slides, but these lasers are basically breaking the ink into smaller particles that your immune system is then able to flush and clear. So with each session, more and more ink is treated and then cleared, so the tattoo fades with each treatment. It's typically safe, so in terms of timing between sessions, it's typically safe to treat as soon as 4 to 6 weeks apart, but we typically recommend spacing a little bit longer as this allows your immune system more time to remove that shattered ink. So Corynn and I usually recommend 8 to 12 weeks between sessions unless somebody's really on a time crunch, they have a wedding or a big event they're really trying to get rid of that tattoo more quickly for. Because spacing your treatments further apart and giving your body that time may ultimately reduce the number of sessions that you need.
So how many sessions are needed is a very common question. Typically giving patients that range of kind of like 8, 10, 12. It is absolutely a process. The factors that are impacting, of course, the size of the tattoo, how deep is that ink, how dense, how much ink is present, the patient's age, where on the body is it located, and just the overall condition of the skin and of the immune system. The factor that I find to be the most telling as far as sessions is going to be the amount of ink that's present, that density. The photo there on the right, the intricate detail, the kind of the fine lines, probably would get pretty good clearance kind of in that 4, 5, 6 range. That darker dense, that hair on that upper part of the tattoo, that's going to take more sessions. It's important to note that the skin, unfortunately, will never return back to pre-tattoo skin, no matter how hard we work, and often sometimes with multiple lasers. Sometimes there's ink that we just can't fully lift. The skin pigment can also look a little bit different following those series of sessions. Most commonly, that skin sometimes can look a little bit hypopigment or a little bit lighter in the treated area.
And you'll see some examples of that when we show you our before and after photos. So we can treat colored tattoos. We can treat all colors. As you can see here, different wavelengths. So those numbers you see, the 532, 755, and 1064, those are different wavelengths of light that can be emitted by the tattoo. They're measured in nanometers. Separate wavelengths are attracted to different pigments. White ink, I should mention, is a little bit tricky. It's a little different. It typically contains a higher concentration of titanium dioxide, which can actually oxidize when it comes into contact with that laser energy, and then it can darken or turn another color after treatment. So not impossible. Even if it does turn a different color or darken, we can then treat that darkened or changed color with the appropriate wavelengths, but it may take more sessions. So white tattoos, pastel tattoos, so baby blue, lavender, anything that has kind of a milky hue that looks like the colored ink has been mixed with white, we do typically recommend treating just with one little test spot to see how it's going to react before we then go and treat the whole tattoo. Also good to note that permanent makeup, so this includes things like microblading, lip blushing, permanent eyeliner, those tattoos use a different type of ink. It's also placed at a different depth than your traditional, tattoo gun used for a tattoo you'd get at a tattoo parlor. That ink is also usually incorporating a pretty high percentage of white ink. So those, while they are treatable, cosmetic tattoos are not without their complications. So definitely we can treat them, but they do present their own set of challenges.
So the lasers that you're commonly going to find for tattoo removal are going to be your Pico laser. The laser we have in our office is the PicoSure Pro, and then the Alexandrite Q-switch laser. Quite similar process. They're both going to utilize the same wavelengths. So as Garrett talked about the different colors, the 532, 755, and 1064, we can tackle those different colors. The main difference between the two lasers is the speed that we're delivering that energy. So with pico lasers, we're delivering that energy in picoseconds. So that's going to be 1/1,000,000th of a second. Whereas the Alex laser, the Alexandrite, is going to deliver in a nanosecond speed, which is going to be 1/10000000th of a second. So that pico laser, we're taking energy and we're throwing it faster at that ink. So with that, we can get that ink to shatter into smaller pieces. Common little analogy that you'll hear is if you had pieces of gravel, the Alex is going to hit it, break it into smaller pebbles, and that pico often can then take the gravel and sometimes shatter it down to sand. Those smaller pieces, which then is going to be easier for your immune system to clear. With the faster energy delivery, we're also minimizing the heat that's produced in the skin, which is going to allow this to be safer for patients with darker skin tones. The Alex, though, is still a key big player with tattoo removal. This laser, although not as fast delivery, we can actually generate higher energies. So sometimes we'll actually choose the Alex and choose that higher energy over faster deliverance. But both of these lasers we do have in our office and are fantastic for removal.
So there are tattoos that are considered a little more difficult. As a general rule, black ink does tend to have the most robust response to laser. So black tattoos do tend to require fewer treatments than, say, the other end of the spectrum. You have your yellow, red, pink. So the sunset colors do tend to be a little bit trickier. That being said, we still do treat all colors. Some colors are a little bit more stubborn than others. For particularly resistant tattoos, so say somebody's done a series of pico and we've gotten it faded significantly, but we've kind of plateaued to a point where it's not really budging much further, we do have a more aggressive option. One of our physicians, Dr. Lisa Ishii, can use a fractionated CO2 device that, in combination with pico and Alex, she uses a multimodal approach all in one. And the addition of the CO2 device creates little microchannels in the skin that then allow that treated ink to escape faster through the skin. So because this is a more aggressive approach, there is more downtime associated with it. There's a different protocol for post-care, and there is a separate different cost for that protocol. So we would recommend then seeing Dr. Ishii for a separate consultation. But it is nice to have another more aggressive approach for tattoos that are just not quite getting where we need them to be.
So contraindications to treatment, the one that kind of always intrigues and generates some curiosity is the oral gold and silver therapy. You don't hear about this much. They used to use gold for like arthritis and some different disease states. If a patient, however, has ever been exposed to oral gold, they have done this treatment, it stays in the system, and when the laser energy hits the skin, we actually can see a bluish gray coloration form, which can be permanent unless you kind of work through that color. So that is an interesting one. White ink, as Garrett talked on, can pose challenges as well, just darkening the color. Patients that might have more of a traumatic tattoo, they were, exposed to some type of combustible material that's embedded in the skin. We would be concerned with like a thermal injury if we did treat over that. The one that we see obviously most common is recent sun exposure, patients that have tan skin, use of self-tanners. We do want patients to be exceptionally cautious with the sun a month before, a month after. We don't want to treat skin that is tan or still sun-glowed from the summer months. Infection in the treatment area, we would also want that cleared prior to treatment. And then pregnancy, we want to wait until after.
So what to expect? In terms of the timing for treatments, it really depends on the size of the tattoo and the shading. For small, 1 or 2 inch tattoos, usually no more than 5-10 minutes. For larger tattoos, maybe somewhere between 45 and 60 minutes. And then very large tattoos, so maybe a full sleeve or a half of a leg, we typically recommend splitting those into smaller segments that are done on different days for a couple of reasons. Number one, it makes post-care, the post-care period easier for the patient and also safer by limiting this amount of surface area that requires wound care and is susceptible to infection. Another I'll touch on in a second. We do use topical and or injected lidocaine to help with discomfort, which is nice, but there is a limit to the amount of lidocaine that can be safely injected or applied topically in one sitting. So that's another reason some very large tattoos need to be split up into multiple sessions. Immediately after treatment, the tattoo will usually be raised and swollen, red or even bruised in appearance, basically just generally looks very inflamed and not very nice. And then we'll get into in later slides kind of what it starts to look like in the days following, but immediately after, just very inflamed, very red, and sometimes bruised. It feels immediately after like an intense sunburn, stingy, itchy, burning, but that's usually the first 5-10 minutes, and then it slowly dissipates over the course of 1 to 2 hours. And it's usually tolerable and no intervention is needed. Tylenol is okay if someone needed to take that. We do usually advise or not advise icing after treatment. Ice can actually make that area a little more irritated. And we'll get into more detail about post-care in a couple slides.
For treatment, we do use the Describe PFD patch. These patches, gel-based barriers, you can see it there in that photo, looks kind of like one of those silicone scar patches that you commonly will find. We place these directly on the skin, and then the laser energy is actually fired through the patch. When we're treating tattoos, when the energy hits the ink, a gas will form, and we see this on the skin with actually this white frosting that develops. That frosting does dissipate with time, but when we're using these patches, we can clear this gas faster. So then we're able to treat like additional pulses, passes if necessary, which ultimately means we're treating more ink in that session. They also help to protect the skin from the heat of the laser. So we're going to see less injury to the skin. Patients have less side effects, less downtime, just overall, just a better experience. We find that they do enhance results. So we're going to be seeing better ink clearance, which then means fewer treatments, less cost for patients, and just, yeah, overall, just a better satisfaction.
All right, so for post-care, we have basically created a wound, so you will need to treat the area like a little injury for the first 1 to 2 weeks. Scabs, crusting, and even pretty significant blisters are all fairly common and a normal expected reaction after treatment. You'll use a very gentle antiseptic spray that we give you called LaserSyn. That'll be applied multiple times per day to keep the area clean and free of bacteria. You'll then apply Vaseline or Aquaphor to the treated area until it's completely healed, which for most people is somewhere between 7 and 10 days, depending again on the density of the ink, the size of the area treated, but usually between 1 and 2 weeks. As Corynn touched on, it is definitely best to avoid sun, particularly when it's in that active healing phase. We want you to avoid all direct sun exposure if possible. I usually have my patients cover the treated area with a bandage or a sleeve if they do need to go outside while it's healing. Also advisable to avoid pools, lakes, oceans, any body of water that could contain bacteria during this healing phase. So that's good to know just in case you have a beach vacation or something planned prior to treatment. Showering is okay though.
Got a couple photos that we'll flip through. These are our patients. So this tattoo here on the left, this was 4 sessions later. Seeing really good clearance of the ink. You can see some areas where we still have some dark ink. To be honest with you, those really dark portions still would see a little room for improvement. So if that patient did do another session, we could clear those dark areas. Skin in some areas does look a little bit lighter, a little hypopigmented. His case is difficult because he does have a lot of sun damage around, so sometimes that too can just create a little bit of a contrast. But yeah, nice result. This was 4 sessions.
Another fun one here. This was red ink, which is really a little more difficult than black ink, but 6 treatments is pretty good results for this type of tattoo. Probably same with the gentleman on the previous slide, probably could have gotten a little bit more if we had continued, but it all depends on patient satisfaction. When you're happy, we're happy. Some patients will also be doing removal prior to a cover-up, so that may require less sessions than if they are never planning to have a tattoo in that area again.
So here, very dark, very dense tattoo. That horse, I mean, you can see a tremendous amount of ink initially. This was over a course of 10 sessions. Also important to note, on the bottom of the tattoo, you can see a little bit of scarring present. Commonly, that can occur when the tattoo is actually being placed. So if you were to feel over a tattoo, you might feel, wow, that skin, actually can feel it. It feels raised. So sometimes, again, that scarring is present. When we lift that ink, you'll start to actually then see some of that coming through. But again, yeah, tougher tattoo, but great move in the right direction.
This was another good example of kind of what Corynn touched on earlier, where your skin is never quite going to look the same as it did pre-tattoo. You can see kind of where the crown was here. Her skin is a little hypopigmented. These lasers are attracted to pigment. So if there is a little sun damage or brown pigmentation present in an area where we're treating the tattoo, that laser energy is to some extent going to lift that pigment in the skin. You can almost, it blends really well. This was actually just one treatment, which is a pretty impressive result for just one. But it's a good example to show you there's still something lingering there. It's not quite like it was before, but the ink is gone.
And this one here, she had an injury. She fell, and we actually had like what we call a gravel tattoo. So this was one session, really great clearance. It's just a little different case. So what sets us apart? So why would you choose Aesthetic Solutions? We have 2 board-certified dermatologists. We're so excited. We're actually getting a 3rd physician with us in October. And Garrett and I are both certified physician assistants doing this for many, many years. When you're coming to us that you're getting the most comprehensive, detailed treatment plan. Care here is also very collaborative. That you have at least 2 minds, if not 3, that are, again, thinking about your case. How can we make this the best? We have different lasers that can be used. So if one is plateauing, we're not getting what we want to achieve, we can really kind of step that up with like a multi-approach. The PFD patch is, a lot of patients coming to us have not heard of these, not been exposed to them. Does, again, enhance those results, overall, less treatments, better experience. And the use of aesthetic agents, something, again, you would think would be common, but sometimes is not. The topical lidocaine and or injected lidocaine makes that treatment better tolerated, more comfortable.
So I'm going to open it up to you guys with questions. We'll just sit and wait for any discussion. While we're waiting, this is a super common question we get about pricing. It varies a lot. I know we've said that a lot during this presentation, but tattoos can vary quite a bit from patient to patient. So pricing is all across the board.
Typically a small tattoo, so something kind of in that 2 inch by 2 inch range. Yeah, we're looking at probably starting about $425. Medium tattoos, we're kind of getting in that 2 inch by 4 inch size, $575. And then if we're getting kind of in that 4 to 4 inch, sometimes we'll go up to then $675. Can increase to, depending on, again, the size, but again, something that we would go over with initially in that consult.
You'll get a customized quote during your consultation. Obviously, somebody to have a square block of shading that's going to take us a lot of time to treat. It's different from just a few little etched lines that take up the same surface area. So it's really hard to say just based on size and surface area alone. It really does take us looking at it to judge how difficult the treatment's going to be, how long the treatment's going to take, etc. And then for really large tattoos, a sleeve or a half of a leg, that's definitely something we would need to see in person before we can give you a quote. So good question. Exercising after, and this goes for any area of the body, we really don't want you to be sweaty or doing any really intense exercise. So cardio, things are going to make you really get your heart pumping, make you sweaty until that area is well healed. So I should say usually about a week.
I would agree. The patient here mentioned the tattoo was on her heel. So areas, again, with shoes rubbing, commonly we will see that skin kind of get a little crusty, some little blisters form. You really do want to keep those blisters intact. That is your body's best bandage. Sometimes if the blister is large, we can kind of talk you through, have you come in techniques to kind of help to express that fluid. We want to keep that skin intact. So I would be worried with like shoes rubbing. Same with clothing. Sometimes we'll have patients actually keep that site bandaged just to protect that skin as it's healing.
Yeah, that's a good note. If it's under a bra strap or an area where it's going to be, there's a lot of friction, we probably would want you to keep it covered. All right, guys. Certainly, if you have more questions or if we didn't address something, you can call us. We will chat through it at your consult.